Good afternoon once again. Thank you for being so prompt. Welcome to this webinar and panel discussion on behalf of New Leaf Health. My name's Samantha Rigby. I'm Client Relations Manager for New Leaf, and I'm really looking forward to facilitating this discussion today. I'm joined by Tim Widdowson and Claire Bennett, who are specialists in neurodiversity, and you'll be hearing from them in a little while. The format today, so we asked you to submit any questions that you have around this topic when you registered for the session, and we'll be bringing those into the conversation for the first sort of section, and then at the end there'll be a live Q&A. So we'll use that meeting chat and live Q&A at the end so that you can take advantage of the expertise in the room today. So a little bit of background first of all into why we're doing this. So New Leaf, as you may or may not be familiar, we've been delivering UK-wide employee health programs now, including wellbeing events, training, consultancy. It's our 30th year this year. And during that time and the depth of knowledge that we've got from going into workplaces, we've established quite a strong network of wellbeing leaders, HR professionals, wellbeing champions, and mental health first aiders who join us on the session today. And we converse with them regularly through various marketing channels. The aim is to bring that network together more frequently this year. So we're going to have a series of webinars on topics around wellbeing. So if you have any topic that you'd like to see discussed in the future, again, pop that in the meeting chat. Our marketing team will jump on that later too. Each webinar will have an expert panel like we've got today, and we'll discuss those hot topics and answer those questions for you without it being too scripted. So the idea is that you very much contribute towards these sessions as well. So today's topic, as it's Neurodiversity Celebration Week, we're going to be talking about neurodiversity in the workplace. And judging by the questions that have come through, it's a topic that has got an awful lot of interest. So thank you for your contributions. To better understand this, the expert panel that joins me today, I am delighted to introduce Claire Bennett, who is a workplace mental health and inclusion consultant and trainer, over 25 years experience in training, coaching and facilitation. And like New Leaf, she's really passionate about helping create healthier and more inclusive workplaces. So she's delivered leadership training across different countries and cultures, which has helped shared her approach towards leadership and human-centered training, and working through workplace mental health challenges as well with organisations. She also brings some personal insight as the parent of a neurodivergent child, which helps fuel her passion for creating a space in a workplace where everyone can thrive. So Claire, thank you for joining us today. I know how busy you are. Also on the panel is Tim Widdowson, again, a very busy person. Tim is a workplace wellbeing and neurodiversity specialist, over 13 years experience training in the UK. And he supports organisations to better understand mental health and neurodiversity, equipping teams and leaders with those practical tools that help make it happen. Drawing on lived experience of neurodiversity and a background in corporate finance, Tim delivers really engaging practical training that help organisations support their neurodivergent employees and strengthen workplace wellbeing as a whole. Tim, thanks for joining us. So to set the scene then, thank you, as I say, for your questions. We thought we'd start by framing what neurodiversity actually is. So I'm going to come to you, Claire, first. How would you define neurodiversity and what conditions does that include?
Thanks very much, Sam. So for me, neurodiversity is, if I'm going to simply put it, I would say it's just the difference in how people think, process information and experience the world around you. It's actually a really natural variation in the human brain. And that's how we would rather see it than it being anything of a deficit or a disadvantage. It's more about it's a natural variation. And so that's how I would describe what neurodiversity is. And of course, there are a number of different conditions that come under that. So you can actually categorize some of those conditions. So the ones that would be classified as more of a clinical condition, and the way that we describe that is really that it would be a healthcare professional that would make that kind of diagnosis. So you'd go through that kind of process. So conditions such as ADHD, so attention deficit hyperactivity disorder. You also have a variation of that, ADD, so attention deficit disorder. So it's removing the hyperactivity element. Autism, or some people might know it as ASD, autism spectrum disorder. And then Tourette's syndrome also come under that kind of that clinical umbrella. And then you have the ones that are what we call applied. So they're to do with education. So what you find is that it would be an educational specialist that would do that kind of diagnosis. So there's two different routes if somebody was going for those kinds of assessments. So the applied dyslexia is the most common and probably the one that most people here will have heard about before. You have dyspraxia, which is around coordination and fine motor skills can be affected by that. It's also sometimes known as DCD, so development coordination disorder as well. So you might have heard it termed that way. You also have dysgraphia, which is, again, fine motor skills, but specific to do with writing and the ability to, form those words and the spacing of words and things like that. So there may be some challenges around that. And then dyscalculia, which again, some people may well have heard of that. It's something that's been spoken about a lot more. And that's really a challenge around understanding arithmetic or sequences within numbers, identifying patterns in numbers and things like that. So those are some of the conditions.
Thank you. And you start to see then why understanding neurodiversity is so important for employers. Just thinking on those terms, Tim, do you have any insights to share around neurodiversity in the workplace and what the scale of that looks like for an employer?
Yeah, thank you. So so we know that like one of the statistics around neurodiversity is that it impacts on 1 in 5 people. So you're looking at 20% of people in an organization are neurodiverse, and we know an awful lot of people are undiagnosed as well. So it could very well be that the numbers are far, far more higher than we actually think they are. There's some studies suggest that it's over 50% of people are undiagnosed. So, when we think about it in a workplace, it's something that it might not be necessarily that we can always tell when someone is neurodiverse. And I think just kind of linking back to what Claire said there about a sort of definition of neurodiversity, I think sometimes we get a little bit confused about terminology and things like that, because as Claire said, it's like the term neurodiversity, it actually means everyone. But quite often what you hear in the workplace is the way that it's talked about is like, I have neurodiversity. But actually, it's like, well, if we think about neurodiversity, a good way to kind of link it is with biodiversity. And if we think about biodiversity, it's like the natural kind of nature and everything that makes up nature, animals, flora, fauna, and everything else like that. And it's the natural variation in the ecosystem. And so if we kind of bring that back into neurodiversity, then we're starting to look not just at the sort of the impacts that might have on a person, but we're starting to look at the strengths of neurodiversity as well, and the strengths of a neurodiverse team. So, it's something that I think in organizations, we're not quite there yet to think about it in that way. But hopefully over time, it's something that as we speak about it an awful lot more, it just helps more and more people to understand the way that their brain works. It wasn't until fairly recently that I realized that my brain works slightly different to other people. And I had this kind of little bit of an understanding and idea throughout my life, but it's only really been in the last few years, actually, that's something that I've really sort of thought about and focused on an awful lot more. So yeah,
and that awareness is sort of really important for you finding your strengths as well, isn't it? So once you understand that about yourself, you know, you're certainly in a better position. One of the other questions that came through in this sort of general arena was about what's the difference between neurodivergent and neurotypical. Claire, do you want to pick that one up?
Yeah, that's an interesting one because we're all neurodifferent, right? There's not one brain that works in exactly the same way. So there's differences for everybody. But I think if you're going to kind of separate what that is, again, it's about the experiences, the processing, the thinking, how we interact. And you might find, for example, for a neurodivergent colleague, that it might differ to a neurotypical because the neurotypical colleague might be more in line with societal norms, right? And what you then might find is someone, a colleague that is neurodivergent, it might not be in line with those societal norms. So that's pretty much the difference, how I see it. It's just, what do you expect in a workplace? Historically, in workplaces I've worked this way. We now know, because we've got such a vast amount of information now that wasn't around before. We didn't understand the brain as much as we do now. We didn't understand the processing and the different things that people can experience. And now we do have terminology for it. We do have more research behind it. We have more knowledge. And therefore, you know, now we're looking at how to maybe adapt some of those societal norms so that actually the environment is inclusive for everybody, regardless of what your neurotype is.
Yeah, thank you. Thank you for that. So we've got quite a lot to get through. So moving on then, and for those listening in, I hope you found that initial setup of the subject interesting. Please keep the chat flowing if there's any questions or comments you have. So looking at the legislation that employers have to work within when they employ anyone, but certainly if we're looking at neurodiversity, the Equality Act of 2010, I believe, is a piece of legislation that covers this. Tim, I'm going to come to you on this one, but Claire, do feel free to jump in. So that Equality Act, what does a neurodivergent condition, when does it get covered by the Act? That wasn't very eloquent at all, but you got the gist.
Yeah, so if we kind of think about protected characteristics, then, you know, neurodiversity isn't a protected characteristic to start off with. But the best way to kind of think about it is that many neurodifferences, like things like ADHD, autism, dyslexia, dyspraxia, for instance, they fall under that umbrella of disability. So the way that I kind of look at it is, or the way that it tends to look at it, is something called executive function. And executive function is like our, I kind of think about it as your sort of control tower at an airport. So, you know, imagine that's your brain. It's this kind of control tower, and it's, you know, got to do lots of different things throughout the day. And it's got to deal with things like weather patterns and flight delays and all the rest of it. So it's very much about organizing and trying to juggle multiple bits of information and holding off launching a plane while another plane's like coming into land. So that whole kind of system around the brain can start to cause slow down. So one of the ways to kind of think about it is you've got that kind of dial-up connection going. We all kind of remember back to the sort of dial-up sound of da-ding, 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 and all the rest of it. So all this information's trying to get through, but it's just struggling to get through on this kind of dial-up connection. And that's not anything about intelligence or anything else like that, which I think is like, it's a massive point. It's about things around, you know, the way that a person thinks and the way that their brain works. So some of these things and the impact that it has on that person will then fall under the definition of disability. So when it falls under the definition of disability, it's when something starts to have a substantial impact on that person. It has a long-term impact, so we tend to say over 12 months, and it has an impact on day-to-day activities. So, when we think about that and thinking about then what we can do to help support someone, there's lots of you've got the legal obligations, but also you've got the social obligations as well in the workplace, well-being, for instance, which is, obviously huge. But we know that as an organization, when something falls under the Disability Act, then an organization must be able to provide reasonable adjustments for that person. And there's lots of different reasonable adjustments, and we won't go into them right now because I think we're going to cover them up a little bit more as we go through.
Brilliant, thank you. So yeah, the one of the questions that sort of fell around this was around legal obligations, but as you say, I think that we're going to talk about reasonable adjustments and what employers can and should be doing to help neurodivergent colleagues. One of the questions, and this is a bit of an emotive one really, but what does an employer's response or lack of one, when does that become discrimination?
Yeah.
And if we're talking about the HR department or whoever the responsible person is for HR within that organization, what do they do when they're in a difficult situation with an employee that is neurodivergent?
Yeah, so it's kind of like when does an employer's response become discrimination? And that's basically when they don't do anything, to start off with. So perhaps they ignore a disclosure, or they fail to explore reasonable adjustments that could be put into place, or maybe that they've got policies in place in an organization which just don't have any flexibility around them. Or there's the the discrimination of just treating someone unfairly because of their neurodifference. Now, one of the things that we know is that ignorance isn't an excuse at the end of the day. So it's up to organizations to understand and to be more aware about how to support people. And there's been some really big cases. There's been a big case with NPower, another big case with M&S. So big organizations that you think, really should know better. And a lot of when you read into those cases, it is around ignorance. It is about not understanding. And a lot of when you read it, it's about maybe leadership and senior teams understanding, but is that passed all the way down to managers? Do they know? Do they have the ability to support people and the knowledge and to know what to do? Because a lot of the things when we talk about reasonable adjustments, which, as I said, we'll get onto in a minute, they don't tend to be that big, and a lot of the time they're very, very simple. And the other thing about reasonable adjustments is that they tend to help everyone, not just a person with a neurodifference. The other thing to just add in there is that a person does not need to have a diagnosis in order to be protected under the disability. So, one of the ways that I look at diagnosis is that actually it's a privilege at the end of the day, because you think about waiting times in this country, 5 years, 7 years in some cases. So we've got to just be able to support every single person, and if someone says, I need help with this, then what can we do to help them? Not to judge them, not to label them. It's not about going around putting the sort of sticky label of ADHD on someone or autism or whatever it might be, but just making sure that as organizations, we're doing the utmost that we can support the people within our teams. And then the other thing I think you just touched on is what to do when actually we feel like we're doing everything to support someone. So there's a couple of different models that, you can look at, but one of the things I think is have we spoken to that person? Have we had a true conversation with someone? If we feel that we've done everything that we can to support someone in an organization, how far have we really gone? And I think sometimes actually it's about starting to look at ourselves as a supportive person. So just understand, are we communicating to a person in a way that that person understands, for instance? And again, this will go on to reasonable adjustments. But, you know, if someone, for instance, is constantly telling me to do things and giving me instructions, well, that is something that I find really hard. So for me personally, my working memory is really, really poor. If you give me verbal instructions and you keep doing it, then you're not going to get a good response. But if you put them down on a piece of paper and actually kind of something that I can read and in a kind of simple bullet point form, then, you know, I'll be able to do it. I'll get on with it and I'll just kind of, you know, crack on it to the best of my ability. So sometimes I think organizations, they feel like they've done everything, but actually they've not really looked enough at themselves about how they're communicating, and they're not asking people, you know, how best can we have this conversation? How best can we communicate with you? And it's a lot about observation as well. You know, what behavior are we observing in that person? It might be that actually we need to put in other types of external support. So OC health support, for instance, or workplace needs assessments, or getting in workplace coaches, neurodiversity coaches, you know, whatever it might be. But I think the first part is really kind of looking at self before we start kind of pointing fingers and say, well, that person's not able to do this, or not, that person's not able to do that. I think, does that kind of answer the...
Very, very much so, I would say. Thank you. And as you say, it does sort of start to come on to the next topic, which, Claire, I'm going to come to you on this one, because I know we spoke about this recently with a client inquiry to do with reasonable adjustments and how an employer can put those in place. So Tim kind of touched on it there, but in terms of the process an organisation should follow if someone discloses that they've been diagnosed with a neurodivergent condition, and then off the back of that, what about someone that's not diagnosed but you're aware of it?
Okay, so look, if someone tells you and they disclose that, thank them, right? Because that could have taken a huge amount for them to be able to disclose that to an organisation, you know. So we should always, you know, thank people for sharing that kind of information with us. Just to build on what Tim was saying there, which is very relevant here, spend some time exploring it, explore what the impact is for the person, rather than jump into, oh, right, we've got to make all of these reasonable adjustments. Don't jump to that straight away. Understand, right, well, what is the impact? What is the impact on the organisation? What is the impact on maybe other people in the organisation? What is the impact on the person? And then you've got a much fuller picture before you then kind of move on. So spend some time exploring that impact first. Once you've got a really good kind of understanding, that's where you can start to identify what some of those adjustments might be. And that is a collaborative approach. That is bringing in potentially experts, so such as those workplace assessments, OC health, of course. You've also got the access to work funding as well. That, you know, there's lots of different places where you can potentially get some of that support in. Don't underestimate the support that's out there from some of those charities as well. You know, the British Dyslexia Society, the Autistic Society, they've got lots of resources that can be very, very useful to organisations. So there is stuff out there. Sometimes you just might have to go and have a look. So bring in what some of those experts might tell you, and what some of those things can be supportive for the person when you're starting to consider what those adjustments look like. And then I also think you can add other things in. So one of the some of the best practice I've seen are things like employee passports. Those can be very useful, especially because, you know, in workplaces there's lots of change. That can present quite a problem for someone with a neurodiverse condition, because if they've just gone through all of this collaboration, figuring out what they need, they embed those things, and then their manager changes, that can be really unsettling. Or even if they move into a different department or a different role, it can be quite unsettling. So having some of those things that are really helpful and secure. I think from a HR perspective, having that kind of process and protocol can be very, very useful. So consider that as well. But then also keep reviewing. Just because you've had that one conversation and you've done it that once, don't then go, right, okay, we've ticked that box. It's not about compliance here, right? It's about ensuring that somebody has the right access. And I think that's where we need to spend a bit more time, rather than just going, okay, we've done that, we've ticked the box and we can now move on. So I do think it's important that you come back to that review and just sometimes just think about it in your mindset. It's not, adjustments aren't there to tick a box and pull something from somewhere else. Oh, that person has dyslexia, let's give them a colour overlay over their screen because that will make it easier for them. It does for some people with dyslexia. It doesn't do that for every single person. So it needs to be individualised. Don't put the pressure on that you've got to come up with all the solutions. This is a collaborative approach, is what I would say. And it's the same principle whether someone has disclosed a condition or they don't have a diagnosis. It actually doesn't matter. If someone is having a challenge in the workplace, which might actually present itself initially, you might think there's a performance issue. Historically, that's how people have seen it. There's a performance issue with this person. So you go down the whole performance route. Actually, what we should try and do as standard is explore where that challenge is coming from, and are there some adjustments that we can do to improve that performance? And then it's the same kind of process that you should go through, I would say, whether there's a diagnosis or not.
Or not, yeah. And I guess that's where things like employee assistance programs can come into play as well, isn't it? To kind of draw on those resources that are available.
Yeah.
I think you've ably answered it, but there was a question around what types of adjustments are most commonly requested and found to be beneficial. And I know you mentioned about the overlay, which I've certainly heard about. Is there anything else that you're aware of? Explain a bit more about the employee passport, because that sounded interesting. What does that look like?
Yeah, so look, it can vary. I think there are some of the charities that might offer templates that you can use and adapt to meet the needs of your organization and your employees, but they're just a really great way for someone to have all of the considerations, all of the adjustments, the ways of working that they might be working towards or working to be able to deliver their role and achieve all the things that they need to achieve as part of that role. But everything is then documented. And so regardless of who the line manager is or who comes in, or if they change roles, then that follows the individual. And therefore, there's a really seamless kind of approach. Everybody has the opportunity to talk about it. The new manager, for example, could sit down with the person, take me through this. Does it need a review? How are you finding things? Is there anything in particular you need me to know about this? That is some of the best practice that's out there when it comes to that pupil. So the sorry, getting my words wrong. The employee passport. So that works really, really well. But I also think some of the adjustments around environment and how you communicate, Tim's already touched on some of those, but the environment, have you got a place where people can work quietly, right? So if you haven't, have you got equipment like noise cancelling headphones, because you might have somebody that's very distracting. Their ability to complete the task that they need to complete within their role is hindered because that distraction or that sensory challenge that they might have around noise, that could be a really real difficult thing for them. So considering that, is there options for hybrid working? I also think a really simple one about work environment is having somewhere separate for people to eat their lunch. It might sound not like important to you, but if someone has sensory challenges around smell or noise or something like that, and you've got someone sat next to you eating their lunch while they're working, that actually can be very uncomfortable for some people. So I always think it's great for well-being, full stop. You make sure everybody goes for lunch, take a proper break, go to the break room. Don't eat your lunch at your desk, because that's not good for you or anybody else. So little things like that, having those things in place can make a big difference. Some of the communication. So Tim was just mentioning, don't give Tim verbal communication. It's better if it's written, right? But other people might need it the other way around. I'm the kind of person, you send me a massive email that's blocked in loads of text, I'm not reading it. I'll actually just shut it down. I'm not going to read it. Okay, so I need bullet points. If you could put some colour in there as well, that would be lovely. And it needs to be short, sharp, and you need to clearly tell me what you need me to know. And that's how I would work much better. So I think sometimes if you think about communication, have it in various formats. So have written instruction, maybe accompany that with a video, and then maybe have a pictorial guide as well if that's available. So thinking about all of those different types, that's true neuro-inclusive, because it doesn't matter what your neurotype is. One of those things will work better for you, right? And you have then the option and the access to just pick on the bits that are going to work better for you. You also need to think about your structure and priorities. Are they clear? Does everybody know exactly what's the expectation is and how those things work? Do we understand them? If there's ambiguity, that can be very, very challenging for all neurotypes. If you think about working structures, so task chunking, it's something that I personally use all the time. I'm terrible for sitting down and starting one task, then get distracted by another task, and then I'm distracted by another task, and then all of a sudden I've got 3 tasks on the go at once and I haven't finished any of them. So the way that I manage that is that I will just time chunk it. So I will set a timer. That is the time that I'm dedicated to that. And then I reward myself with a 5-minute break and a cup of tea. And then I come back and I do the next one. And that works better for me, right? So I don't have a diagnosis of a neurodiverse condition, but I absolutely know that works for me in terms of the way that I manage my workload, right? So things like that, flexible deadlines. That's not to say, oh, I'm going to take all your deadlines away. But what you might do is stage them or stagger them. So you might say, right, this is the end date. I need this piece of work completed by this date. But actually, what I'm going to do for this particular individual, because it works better for them, is to give them a number of different deadlines throughout that helps to keep them on track and keep them focused. That might be a way of working that works really well. So it's about, I suppose it's about the flexibility, and structure and protocols. How does the meeting work? Does everybody understand how the agendas work? Are the agendas sent out beforehand? You'll have some people that won't even look at them, but you'll have others that would actually feel very, very disorientated going into a meeting where they hadn't already seen the agenda. So, just having those options and those different things in place can be a great way and a very basic way of working that actually doesn't cost anything at all.
Yeah. It's interesting you saying about the task chunking. I attended a webinar recently where they talked about the Pomodoro effect, and that's exactly what you just described, where it's like 25 minutes on, 5 minutes off. And I do that now instead of butterflying, and that helps massively. So thanks for the reminder. There's a question popped up in the chat actually, which arguably could come into the next section, but we'll cover it now. So Tim, I'm going to come to you on this one. Do you have any guidance or information relating to burnout for people with ASD? In particular, tools or techniques to manage burnout for both employee and employer? Quite a lot to go at in that, but is that clear?
There's a lot there, isn't it? But I think, like, going back to Claire's point, the most important thing is recognizing that everyone's needs are different. So, when we think about ASD, for instance, and we think about burnout, actually, what someone's experiencing could be very different to another person. So again, going back to actually just having that conversation with them, finding out, is there anything in their environment that might be causing them particular stress and things that they're finding a lot harder. And it might not be that we can change the environment, and it might not be that we can change deadlines or whatever it might be, but just having a conversation with someone, going back to, if we think about things like sensory overwhelm, for instance, if someone's working in an office with loads of other people, then, how do you deal with the kind of like light? Like I'm quite sensitive to light. As soon as I go outside, even if it's a grey day, I'm slapping on the sunglasses, to be honest, because it's something that I just find really, my eyes are really sensitive to. And, going off on a little bit of a tangent, but I was speaking to someone in an organization and they were really struggling because they had someone that had that particular, light sensitivity. So what they found is that everyone in the office was pretty much working in darkness because they'd turn the light right down. And that was just no good for everyone. So it's kind of like, how can you find that middle ground, whether it is like making sure that that person has access to a quieter room that might be a little bit darker and has the ability to go off and just take some time out. Maybe it is about written instructions, for instance, as we said. Maybe it is about predictable routines, which I think is a huge one to help support people. Like just knowing what that person's got coming up in their day. One of the things that I find really, really hard is change. I mean, no one likes change, to be honest. But someone with a neurodifference, like autism, for instance, change could be absolutely massive for them. So if they're going into work one day and they're thinking, this is what I'm going to do and this is what I'm going to get on with, and then all of a sudden that changes, and it's totally unexpected, then that can have a huge impact on someone. Even thinking about that person like commuting into the workplace, are they commuting it into a busy, through kind of busy town environment and things like that. I was speaking to someone recently and they just stopped driving into work, got public transport, and they were very, very close to having to leave this workplace. And they loved their job. They absolutely loved it. But they found that they were just so anxious and, as you said, feeling burnt out throughout the day. And actually, it wasn't anything to do with the workplace. It was to do with getting to work. Now, that only came out in a conversation, about, what someone's experiences are and just try and help someone understand. And a lot of time, people won't even know. So for me, I think there's a lot there, like, clear communication and everything else like that to support someone, language around communications with regards to, deadlines, for instance. This needs to be done then by this time. Can you make sure you do it there, backed up in written form as well as verbal? But I think it goes a lot further than that. I think it's about organizations looking at their place of work through the eyes of a neurodivergent person. And that's like everything, that's culture. That's about being proactive. That's thinking about things from like the hiring process. I sometimes think hiring process is ridiculous. It's kind of like you get someone in for an interview and then it's like, right, we're going to catch you out with these amazing questions. How big is my ego if I'm thinking about doing that? What's wrong with giving people the questions before the interview? Because how many people's roles actually require them to think about the best answer in, 3 seconds flat? So things like that, what can I do to help you, to support you to be the best of your ability? Even showing someone around their place of work before they actually start in their role, thinking about the building and the layout, what things can be done to just help support, and not just a neurodivergent individual, but everyone at the end of the day. So I know that's not specific with regards to ASD, but the thing is that everyone's experiences are slightly different at the end of the day. And, we could come up with 101 reasonable adjustments for someone with ASD or ADHD or dyspraxia, dysgraphia, or whatever it might be, but it might not suit that individual person, and that's the really big thing. So that listening element is, it's always so important. And just being gentle and just trying to understand it from a neurodivergent point of view. And even language that we use, I don't always think the language that we use when we're talking about neurodiversity is the most supportive. A lot of the time when we talk about things like conditions and diagnosis and all the rest of it, I don't think it really helps people to feel comfortable about opening up. I think we need to start looking more at the positives and the strengths of different neurotypes, rather than just always looking at kind of like deficits and challenges that people might experience. Went off on a bit of a tangent then.
No, it's all relevant, Tim. And I think you touched on that bit earlier, Claire, when you mentioned around sort of finding the strengths of that neurodivergent population and working with that. And I think the open communication, would you say, is the way for that? Is there any other top tips on bringing out that strength element?
Yeah, well, I mean, there are loads of best practice out there. There's so I live in Gloucestershire, so GCHQ is actually not that far from me. And about 2 years ago, they had a massive drive where they had very specific roles within cybersecurity that needed a particular skill set, and they were actively looking to recruit people with autism, for example, because some of the traits, or people that might have traits associated with autism, and those traits were going to be really valuable to that organization. You will find that, you know, you might look at, okay, someone with ADHD might not be able to complete a task in one kind of sitting, potentially. I don't know if that's the right word, but I can't think of another one right now. But that might be what you want that person to do. But actually, what else do they bring to your organization? They could bring loads of innovation. They could, you know, challenge some of the status quo, which means that your business grows and it develops and it, you know, has loads of amazing new ideas that they bring into market. You know, you have all of these different things and skill sets that if you just purely look at the societal norms that might jar against some of the traits, then actually it's a real short-sighted way of looking at your population of the workforce, which of course every single person will be neurodifferent. And I know that might sound complicated to an organization, but you know, are we being fair? Is it, you know, how can we be consistent? Are we setting a precedence? Those are genuine fears that organisations have, and understandably so. But I actually think we need to adjust our mindset, because we're just adjustments are about equity. They're not about giving somebody an advantage, right? So you wouldn't think twice about putting a ramp in for somebody in a wheelchair, because all it means is they're not advantaged over the person that's walking up the steps. It's just they have the same access. So we need to start thinking about it in those terms, that we're just trying to create an environment and, you know, working practices that allows the business to get what it needs from all of its people in the best way possible, keeping them all healthy, all happy, and a place where everybody can thrive. It's not about giving somebody an advantage. And I think sometimes that is a concern that some people that I speak to have.
Yeah, I think you're right. I think some of the clients that I've spoken to, consistency is the tricky one, isn't it? Just you touched on autism there, and actually there were quite a few questions specifically asking around ADHD and autism and supporting those conditions in the workplace. Tim, if I can come to you. So one of the questions here is specifically, they're talking about an office or a call center setting as opposed to any other kind of workplace. But what does ADHD, what does that look like? So someone, I'm not quite sure whether they're trying to get to, they're not sure if this person is diagnosed with ADHD, or how can someone with ADHD thrive in those settings?
Yeah, and again, it doesn't matter, diagnosed or undiagnosed.
Doesn't matter, no.
And, you know, someone might not know at the end of the day. And I think, again, a lot of the times, you know, if we think about what does ADHD look like in the workplace, you know, particularly in the office or a setting like that. And I think sometimes, you know, there's that tendency that we're going to come back with things like, well, that person could be more distracted. That person could be more impulsive. That person might find it hard to sit still for a long period of time. And they're the sort of the things that the challenges that someone might experience. But at the same time, how can we look at things like, well, actually, that person's got really good energy levels throughout the day. You know, that person actually, excuse me, has a great ability to hyper focus, for instance. A person that actually, you know, is far more flexible, spontaneous, for instance. They're far more creative. They have a kind of willingness to sort of take risks, where some people in an organization might be more risk adverse. And again, that kind of comes back to, you know, thinking about productivity, you know, there's, and again, loads of different studies around this. Deloitte did a study that showed neurodivergent teams were 30% more productive. JP Morgan Chase did a similar bit of research, but it was in tech, so slightly different to call centers. But they found that neurodivergent teams were actually 90 to 140% more productive. But even though we've got these kind of ways of looking at the kind of the strength someone might experience and also what they might experience with regards to challenges in the workplace, a lot of it does come down to the environment. So it's about supporting that person in the environment and thinking about a kind of busy call center and all the rest of it, open plan floor, you know, and it is those things like, you know, Claire's already said, noise cancelling headphones. Is that person that actually they're able to hyper focus and they're able to go for 8 hours constantly because they've got such a huge amount of energy. Just because someone can do that, is it right to enable someone to do that? Or is it about encouraging someone to go and take breaks and take some time out and have that kind of quieter space that they can go to? You know, what sort of things might help, you know, every single person, but specifically might help a neurodivergent individual like someone with ADHD, for instance. Now, one of the things that we tend to find, and this is kind of going on to another point, is we tend to look at neurodivergence as a spectrum. And whenever we look at something like a spectrum, we tend to look at it as a bit of a line. And people kind of use really negative language like high functioning and low functioning and all the rest of it. But actually, when we look at neurodivergence, the best way to look at it, or one of the ways that I tend to look at it, is a bit of a mixing desk. So on a mixing desk, we've got lots of different things. What do you call them? Go up and down, sliders. Buttons, sliders, that'll do. So we've got all these different sliders, and each slider represents a trait, right? So that trait might be the fact that that person has is really good with routine, for instance, or they're able to be really, really creative. So you've got all of these different traits. And as Claire was saying before, what we tend to find is that for a neurotypical person, those sliders tend to be in the middle. But for a person with a neurodivergence, actually, they tend to be more at the extremes. So you might have someone that is really, really creative, for instance, and is brilliant at all those kind of creative things. But at the same time, they really struggle with routine, and they really struggle with kind of like that sitting down all day. So we tend to find that the challenges happen on the same trait. So where you've got one thing which actually is a massive strength, it's kind of like, well, what's the opposite of that, which is might be something that we can help support someone with, which, as we said, tends to come back to that person's environment or communication or that sensory overwhelm that someone might experience.
I really like that analogy. I think that explains that really well, actually. And I know we've said it doesn't matter about if someone is diagnosed or not, but what about a manager that perhaps thinks someone in their team is struggling, but doesn't want to make any assumptions? And what sort of support or diagnosis support would you recommend that they sort of have? You know, what conversation can they open up with them?
Yeah, it's hard, isn't it? Because, you know, we don't want to go around and sticky labeling someone and say, right, I've noticed this. You know, all behavior is communication. And at the end of the day, we can't spot a particular behavior and put someone with a label of autism, ADHD, or whatever it might be. But it's understanding more about that. And it's not going up to someone and say, I think you have this, or I think you have that, because it just might not be. You know, we all feel overwhelmed after a really busy day where there's been lots of kind of noise, external noise and interference and all the rest of it. Doesn't necessarily mean that that person is neurodivergent, for instance. So again, it is just about asking the question, you know, like everything that we're doing, it's kind of coming back to communication. You know, how best can we help you? I've noticed this, you know, and having a conversation. Not saying I've noticed this and I think you are this, that, or the other, but just saying, like, I've noticed this, and helping that person to just feel comfortable enough to open up. We know, and there are, statistics out there that shows, I can't remember what the exact figure is, but it's something like 70% of employees don't have confidence in their manager in talking about, everything that we're talking about here, including like neurodiversity and mental health. So how, as managers, can we help people to feel comfortable that they can have an open conversation with us? But why should I come and have a conversation with you? Because all through my life, I've been looked down on as being kind of lazy, perhaps, or being unmotivated. And that goes right back to schooling for so many people. And as I said, 50% of people that are neurodivergent are undiagnosed. Then actually, there's we know how much anxiety builds up over the years from what someone's experienced in school and gone through teenage years, adolescence, and into the workplace. So, you've got to show me that you are the right person to come and have a conversation with and open up to about what I'm experiencing and what I'm going through. And I just don't really feel that many managers have the confidence to have that conversation, to be able to just sit and to support someone and not to sticky label them, but to, ask them, what can I do to help you work at the best of your ability? Is there anything that you need? And that person still might not know at the end of the day. So then how can we just try and put things in place, tweak our communication? Is there a better way that we can communicate? Are there other types of support that we might be able to offer someone? Whether it is, talked about the EAPs and OC Health and passports and everything else like that. It is about, perhaps encouraging that person to seek other types of support. So whether it is, going to the doctor or NHS or whatever it might be. But again, diagnosis can take absolutely years for someone to get. So it's about supporting that person in the moment and just not sticking and labeling them. What does that person need? And trying to think a little bit more out the box. I think we tend to think like, and Claire said it before, every single autistic person will need this support, or every single person with ADHD will need this support, but it's just not the case. And there's so much co-occurrence as well. So different neurodivergents that overlap. Someone might have ADHD, for instance, and dyslexia, or any of the different neuro differences.
Yeah, I think I've heard you talk about that before, actually, Tim, and that, and Claire as well. So Claire, just building on that then, and there's a question come into the chat there about how, in practical terms then, how do we make this neuro-inclusive culture something that's a bit more easier to grasp and get our heads around? What does that look like in practice? And we've talked about communication, and that is clearly the key to all of it, isn't it? But is there anything else that we can give as practical advice that people can go away and start to do today?
Yeah. So I think if you're going to create a neuro-inclusive culture, for me, that just means access for all, right? So you have to consider all different ways of working. So how flexible is your workplace? Right, because traditionally workplaces are not that flexible, right? If you look at the setup of a lot of businesses, they're not, because everything goes towards the societal norms kind of perspective. But is there flexibility? So does an organisation, this is what we need to achieve, but does it really matter in what order it goes in how it's achieved, as to the location the person completes that task? Does it have to be task orientated? Can we be more output focused? Because I actually think if we can change our mindset when delivering businesses, then actually, if you look at the outcomes or the outputs that we're trying to achieve, then how you do that bit is up for debate, right? And so sometimes I think it's really considering how flexible is my work environment. Have we ensured that our working practices meet a number of different needs? just like communication, just like work location, just like the lighting, it's just access. It's just saying, right, okay, so if you're someone, you might come in, you might be classed as neurotypical, but you come in with a headache, and actually I might go and sit in a quiet space it's not as bright, because I can still get on with my work, but that's accessible to me. But it is also accessible to the person who's neurodiverse, who might need that kind of setup as well. So it's access for all. And I think sometimes we get bogged down as, oh, we've got to do this for this person and this for this person and this for that person. And actually, if you want an inclusive environment, then it's about looking at that as a much broader spectrum and bringing in lots of different views. So don't sit there in isolation as a HR team trying to create this. Talk to your organization, talk to people. What helps you every day that makes it feel more comfortable? How do you work best? Do you work best when there are deadlines? Would you work best if there were stage deadlines? How does that work? How could our working practices try to involve as many of those different accessible points as possible? But I also think the other thing that Tim has just touched on is a very key important part of a neuro-inclusive environment, and that is that psychological safety. So do I feel confident to disclose that I might have a difference? Or even if I'm not sure if I do, am I able to feel confident enough to say to someone, or my line manager or someone in HR, do you know what, I'm finding this really hard. This particular way, I either can't get my head around it, or it's not working for me, or it's actually causing me more stress. I'd like to discuss what we can do about it. If you have an environment where people feel comfortable to do that, then that's for me is a true neuro-inclusive environment. And those are some of the practical things that you can consider. And of course, access to coaching, training, educating and training line managers. All of those things are practical considerations, but you must have the working practices to back all of those things up.
Yeah, someone else has actually just asked earlier about could the neurodivergent person have a session with a specialist to create that employee passport? That sounds like almost a coaching consultancy kind of project, doesn't it? That we, organisations could receive some help with, and certainly New Leaf can help with any of that. So we've got these specialists that can reach out and help you. So do contact us. We'll be reaching out with a recording of this session to everyone that's attended, and you'll have an opportunity at that point to contact our team and come back to us with any requirements you've got. Thank you both. We're coming to the end of the session, and I think we could have probably gone on even longer. Clearly the subject is one that's inspired debate. Just as we come to an end, thank you for your comments in the chat. The team that you see in front of you, as I say, work quite closely with New Leaf Health. So do contact us if there's anything in particular that you'd like some more clarity on or another conversation around. I think you'll all join me in thanking Claire and Tim for their expertise. I think it's really enlightening and actually quite comforting to hear it's not as complicated as we think it is. And having the conversation is certainly the first part. As I say, when the session closes today, we'll send this recording out to everyone that's attended. Love to hear your feedback. Thank you for the comments coming through in the chat already. And yes, you should be able to share that recording on with colleagues that weren't able to make it today. Just to note that the next Workplace Wellbeing Network meeting and webinar like this will take place in May. Around Mental Health Awareness Week, and we're going to be looking at the link between mental health and menopause, which is something that we've been asked to look at. So we'll be keeping you in touch with the registration for that too. Thank you again for your time. I hope you've enjoyed the session today, and thank you, Claire and Tim, once again for joining us.